Happy Tuesday, y'all. We're back for another part 2 for Vbac preparation. I'm very excited because last week we talked about how to make sure that your mind is ready, understanding the myths versus the truths of Vbacs, and really, truly, and honestly figuring out if Vbac is truly an option for some of us, which if you watched last week, you know that it is actually very possible for most of us if you know what you're supposed to do and you know how to prepare yourself. So today we're going to take that conversation a little bit further and deeper, and we're going to talk about preparing your body and finding the right birth team for your Vbac. So I'm also going to be having this conversation again with Serenity Life Doula, also known as Krisha, my doula. And so I'm very excited to be able to dive in deep, and we're going to just have a conversation. So if y'all have questions, make sure that you put them in the comments so we can kind of address them as we go, or we'll try to address them at the end, but just make sure that you put them in there so that we know that you have a question and we don't end the live early. So she just joined, so we're gonna just bring her right in. That way we can conversation. But nonetheless, I'm very excited because there's just so many things that we can share with y'all about Vbacs and preparing yourself and knowing how to put yourself in the best possible situation to actually have a Vbac, because so many times a lot of the things that are holding us back are things that are within our control. So hopefully this leaves you inspired to make the changes that you need to make within yourself or within your surroundings and the resources that you have so that you can achieve the Vbac that you are going for either now or in the future. So she's joining. Yay, this is perfect. Sorry, y'all.
Okay. This takes a while.
I know. I always I'm like, I sent the request. I don't know if she got it. So anyways, welcome back.
Welcome. Hello.
So I just did a little bit of an intro, just recapping last week. So again, if y'all did not see last week, it is up for you guys to rewatch after this. It's pretty short. It's 20 to 30 minutes long. So make sure that you guys go look at that, because these are two parts. We couldn't get it all in one because there's so much information and there's still so much more that we're not even going to be able to cover tonight. So make sure you watch both of these, and then we'll share some other opportunities at the end. So where do you want to start? You want to start at healthcare providers? You want to start at body? Which one do you want to start?
I want to start at healthcare providers because that's kind of important. Taking care of your body is too, but man, it takes the right type of healthcare provider, like-minded, to be successful in your Vbac desires.
Yeah, and so I'm going to share my, how I chose my healthcare provider, and then let's just talk about what things that they should look for. And I'll kind of share some of the things that I looked for. So like Krisha said, before anything, before you start preparing your body, the minute that you find out you're pregnant and beforehand you wanted to have a Vbac, which is, for those of y'all who don't know, it's a vaginal birth after cesarean. You're probably thinking, okay, I'm going to call my OB, or I'm going to find somebody else, depending on what your experience was previous to this pregnancy. And so that was my mindset. I knew once I started to learn more about Vbacs and that it was a possibility. I think I even called you, honestly, before I confirmed. I don't remember if I had confirmed the birth center yet, but I knew I needed to be around natural birth, like-minded individuals. Mm-hmm. And so when I was looking up the birth center options, I knew I didn't want to be in a hospital setting again, because that was just traumatizing for me the first time around. So I personally had trauma associated with that experience. It wasn't like hospitals were bad or anything. It was just that I did not want to have my next birth in a hospital. I wanted to try another option. Right. And there were resources for me to do that here in the Dallas-Fort Worth area. And so I started to actually look up and call some of the birth centers to tell them, hey, I'm a Vbac candidate. Do you guys, accept Vbacs? What is your experience with Vbacs, so on and so forth? So I actually did an interview process I interviewed my midwives, and I was like, hey, this is what we're going to do. My husband sat there with me. This is what questions I have. What is your experience with Vbacs? What is your outlook on birth? So on and so forth. So I did that with both of, or a few of the different midwives in the area. And then from there was how I made my decision. And then obviously looking at just their own stats and what their experience was with VBACs. And really, did I feel like there was a good fit? Did I feel like I could trust this person? And did they have experience with VBACs before? And what was their success rate with that? So I'll obviously dig in deeper to like, you know, what things and questions and things like that to look for. But that was in a nutshell, very short, like kind of how I went about choosing my healthcare provider. And I knew, even though the OB that I was with before, even though he and I, like, and my husband, we all like, you know, meshed well, when it came time to the big day, there was not as much alignment as I thought there was. And so I think relationship plays a huge role in the first part of the relationship and like being able to have conversations and things like that. But I realized that, my midwives in particular, they actually like took an interest in me before I even became a patient. And that was like a huge selling point for me. It was like, these people actually care about me, even if I don't end up becoming their client. Mm-hmm. So I think, you know, just kind of seeing and feeling out like how many people are actually like pro you versus like pro take your money, become my patient for numbers reasons. Mm-hmm. And somebody just asked like, how did I look through for providers through insurance? So that's actually a great question, which I actually didn't plan on covering tonight, but I'll just do a little snippet of that right now. So birth centers, and that's the also unfortunate thing about this whole society. Birth centers and midwives are not always covered under insurance. And depending on what your insurance is, you would need to check that out for yourself. But sometimes, because it's becoming more available to use insurance with midwives, even if your midwife or birth center is not fully covered in your insurance package or plan, sometimes if you call your insurance company, or you will have the birth center or midwife call your insurance company, sometimes they will allow you to have an out-of-network cost versus having like this full-on cash price. And so because my midwives, my birth center was not actually covered in my insurance plan, they were able to make exceptions and do like an out-of-network cost, which is only the cost of our deductible. So it ended up being a lot more affordable than, you know, anything else. And truly, honestly, when you compare like my previous emergency cesarean bill from the hospital and a natural birth at a birth center, it ended up being just about the same. So I actually don't feel like this like myth of it's more expensive to have an out-of-hospital birth is actually true. So obviously that's not what we're talking about tonight, but to answer your question, that's where it is. So anyways, thoughts on, you know, just like healthcare providers and how to go about like choosing them and what you've seen, because you've worked with a lot of different healthcare providers. So like, what have you seen as the major like differences between somebody who's VBAC supportive or who's VBAC non-supportive or not, you know, not really compliant with that?
Major difference is, I think, how comfortable they are with VBACs, their competent skills in VBACs, and whether honestly they just want to deal with it or not. I know it sounds terrible.
I know.
But it's true. You have these healthcare providers who are like, yes, you can do it. Everything aligns. Your medical records give you the okay to have a VBAC. Let's go for it. You want to do it, put in the work. Let's go for it, right? Mm-hmm. There's a lot of like-minded people out there. But there's also providers that were like, oh, no, once a cesarean, always a cesarean, which is not true for everyone. Actually, it's not true for most. For a select few, yes. There's just
it's 90%.
Yeah, whatever happens. But a lot of it is the healthcare provider's thoughts on it. Or do they do VBACs? To them, it's easier to do a cesarean. I'd rather get in, schedule it, get out. Right? So that would be conversations you need to have. You know, if you've had your first birth ended up in a cesarean, or maybe your first pregnant it ends up like that, that would be a question to ask at your postpartum visit at 6 weeks.
Yeah.
Have that conversation. What are their thoughts on this? What do you think? You know, did you stitch my uterus properly so I can have that type of, you know, question? And then have those conversations then. So if you decide to have more children in the future, whether you're going for a Vbac 2, Vbac 3, whatever, you know ahead of time. And then when you make plans to have another baby, then you know, stay with this person, or nope, I need to start doing my research and find someone else. And it's your due diligence of making those phone calls. Same thing with insurance. You have to call and see, hey, do you take insurance? Do you take this type on anybody? So it's really up to the birthing mom, or the mom who desires the VBAC, to have the questions. And you want to word these questions in a certain way that, like Chanel said earlier, you're like, oh, we were jiving, our healthcare provider was great, you know, things were going good, we felt great, they're supportive, and then whap, 37, 38 weeks, somewhere in that range, they're like, ah, and red flags pop up, and all of a sudden you thought this was a great relationship, and you're like, it's no longer a great relationship, because now they're taking back everything they nodded their head to. Previously. So that's why you've got to start making healthy conversation with your healthcare provider before 36 weeks.
Yes. And I think really too, it's important, like, it's really important, to Krisha's point, talk about what your wants and your needs are very early on. Because sometimes people will say, oh, well, we're not going to go over your birth plan until 36 weeks. Well, that's late. I mean, and it's okay to go over that like final plan at 36 weeks, right? That's totally fine. But I need you to know what my desires are. Because if I'm telling you I want a natural birth and I want to be in upright positions and I don't want to push on my back, I need to know whether or not you're okay with that ahead of time. Because some hospitals, and you'll I don't even know if you've heard this before, so you can tell me. I have a client who is birthing in a hospital, and her doctor told her, because she wants a natural birth, and she was told that it is required that she delivers her baby on her back. And I was like, that's a little bit interesting. How can you require me to give birth on my back? We all know, if you followed Krisha and I any amount of time, you know, birthing on your back is not ideal unless there's like a medically necessary reason, which you can still birth on your side. You know, like, that doesn't require, even with an epidural, you don't have to birth on your back. And so when she was told that this was required, she's like, that's weird. That's strange. And so these things, she's not close to 36 weeks at all. And she's been able to have that conversation. So I think it's important, y'all, to have, especially if you're going for a VBAC, and especially if you're in a hospital setting, make sure that you have these conversations and ask those questions to say, I want to do this. I want to do that. I want to do this. How have you done this before? How have you supported this before? And here's the other thing that y'all need to ask. What is your VBAC success rate? What is your cesarean rate? What is your C-section rate, right? How often do you do C-sections? How you should be looking at the hospital. How often does this hospital or birth center, or wherever you're going, what is their C-section rate? What is their transport rate if you're at a birth center? What is their induction rate? These numbers, like, your providers have these numbers about themselves. And the other thing is, like, oh yeah.
I want to add one.
Yeah.
How do you prefer to deliver babies?
Yeah.
Some people prefer to deliver cesareans because that's where they're highly skilled in. There's nothing wrong with that.
Yeah, of course.
And then some are highly skilled in vaginal births, laying on your back with your legs wide open. And some are skilled in get in your position and I'm just going to catch your baby.
Exactly.
So there's different skill sets. So you have to line up what your preference is and the skill set of your healthcare provider. Super important. And if you get anything else, I don't have a red flag. I need to buy a red flag.
I know.
That's a red flag. That's a red flag. What you said earlier, I'm like, red flag.
Yeah.
And they go, oh, yeah, that's good. Oh, we can do that. Oh, we'll talk about that at 36-week appointment. That is a red flag.
Red flag for sure. Yeah, and it's just, and that's the thing, Raul. If you start to see red flags, like, that's what I did not do the first time around. I was very clear with my provider. I want a natural birth. I want a natural birth. And he said to me, okay, all right, cool. About 90% of my moms say that, and then they end up getting an epidural. I was like, And at the time, I just was very confident in myself to say like, okay, cool. Like I'm not 90% of your moms, and I'm going to have a natural birth. But what didn't register for me at that time was, no, that needs to be a red flag, and I need to really think hard and true about this if I'm going to stick with this provider, because that is going to really set the tone for what kind of support I'm going to get in labor. Mm-hmm. Like if he's saying, oh, most of them get epidurals, well, that should cue me to think and know, well, I'm probably going to be offered and pressured into an epidural very quickly. And I'm going to get pressured into a lot of other interventions very quickly. Because for whatever reason, maybe natural births take too long, or whatever the situation may be for some of his patients. And this is one of the highest rated like providers in our area from like an OB's perspective. He's like has a lot of accolades. And so again, it's not that this provider is a bad provider. It is just that he did not align with what my plan was for my birth plan. And so again, you have to really make sure that you're vocal about that. And then the other thing too is, especially for VBACs, because this is such like not a touchy subject, but it is so rare for some providers to be so pro VBAC. Like there's probably a very small amount of providers in most areas that are just like very, very confident in doing this, even though it's not necessarily risky. It's just that for whatever reason, they may feel like there's more liability or something like that. And they, like Krisha said, it's quicker to do another elective cesarean. But once you become educated and once you start to ask these questions, you will start to see like, okay, they're going to wonder why and how I know all this information. Like, one, it shouldn't be secret, right? But two, once I start asking these questions, I'm like, well, how did you know that? Well, why are you asking us that? And then like the dynamic kind of shifts, right? And you're like, why are you asking me all these questions? And so you get to really get a feel for like being an educated patient at that point, because it does change the dynamic of how supportive your provider will be. So
you'll be treated differently too, because you're educated.
Exactly.
Yeah.
And one of the questions was, how do we find, where do you find providers that support VBAC? So I think the first thing is like, one, trying to do your own research on like the providers in your area. And I would, if it were me, because I don't believe that there's like, they might have something on VBAC Link or VBAC Facts, but I'm not sure. Would be, for me, it would be starting at what providers are in my area. And I would just start by looking at their stats on their website. Looking at the stats of their website, if you're going to a hospital, what are the hospital's rates? What are their C-section rates, induction rates, all those things for the hospitals that they deliver at. Because just because you have a great provider doesn't mean that the hospital setting that you're in is going to be in alignment with that. And your provider is truly only there for a short amount of time for your entire birth. So depending on how your nurses are, like that could impact how your labor goes as well, and vice versa. So that would be where I would start. And then once you kind of narrow that list down, then call and start interviewing.
You can also reach out to doulas in the area.
Oh yeah, that too.
Doulas are part of a doula's job is to provide resources.
Yeah.
And doulas will do that. I do it in my area. So when they ask me, I try to give them advice, and I try to do it nationwide, but I just don't know everybody nationwide. But I at least try to help as much as I can, or connect them with a resource that can help them in that area. So, hey, try this. Hey, try that.
Yeah.
So you can always find a doula locally and just ask a question, because they might be in the know as well, or reach out to a midwife in the area. I think midwives have a little bit more tendency to be VBAC friendly. There are some really great VBAC friendly OBs out there as well. You have to like find that needle in the haystack, and then you need to interview them and see that they match up, and make sure, like you were saying earlier about the red flags and talking about that, emotion-wise, is if you walk into your appointment and you're excited and you get to hear your baby's heart rate, and then the appointment goes on and you go into your car and you're crying your eyes out because something happened at your appointment, that's a red flag too. You need to watch how your emotions are. You should walk out of your OB appointments or your midwife appointments and be like, this is great. I love being pregnant. I got to hear my baby's heart rate. And oh my gosh, they gave me so much information and made me feel so good and comforted. That's also, I think, the only reason I'm pointing that out is because I get a lot of messages that are like, I'm crying in my car right now, and this is what such and such said. And I'm like, oh gosh, that's a red flag. So I just kind of want to put that out there to also watch how you feel when you leave that space or that environment or that person. Is it uplifting or is it down?
Yeah. And the other thing too, when it comes to your providers, right? This doesn't matter whether you're at a birth center or you're with an OB, right? Midwife or OB. There's always usually a team, right? There's a team of providers. So there's a team of midwives and there's a team of OBs. And depending on when you go into labor, you may have your main OB, main midwife, and you may have somebody else that's on that rotation. And the other thing you have to think about too is if you have the ability to see and to have appointments with all of these providers, it's important that you also share your birth plan and your wishes and desires with them as well and get a feel for them. Because if your doctor is not on call when you go into labor and you're stuck with somebody who you're not comfortable with, then that is also going to be a little bit problematic for you. So like, get to know all of them. Yeah. So
you're right.
Yeah.
You're right.
It is.
So open up and write it down on a piece of paper, your questions, and take it in there.
Yes. And also don't settle, y'all. Like, this is like one of the biggest moments of your life. And so if there's something that is not right for you, like, do not settle. If you need to switch providers, switch providers. Yes, you may experience some inconvenience to have to switch providers. It could be stressful to switch providers, but like in the long run, what is more important? Is it more important to deal with this little bit of stress or reach out to one of us or reach out to a doula in your area and find somebody else who may be may be able to support you better? Or is it better that you just stick through it and try to push through and then end up in a situation that may remind you of your first, right? Remind you of your first situation if that wasn't very enjoyable for you or whatever, right? You're just kind of stressed and you carry that into labor. So you're going to be coming into labor more tense, which is going to cause your labor to take longer. It's going to cause your labor to be more intense or more painful for some of y'all, like whatever that is. The other thing too is like, even if it's not your provider, if it's a nurse that you're not comfortable with, I don't think a lot of people know this, but you can fire a nurse. So if you're in labor and you're like, this person is just not vibing with me right now and it's really causing me anxiety, you can ask to see another nurse. You can say, you don't have to make it confrontational or anything like that. You should never be confrontational, of course, but you can fire a nurse and get another one that's on call or on shift or whatever, because that you need to keep the environment and the ambiance to your liking so that you're comfortable and you feel safe and secure and supported in that environment. So anyways, there's healthcare providers for y'all. Obviously we probably went really in depth on that, but hopefully that was helpful.
We're passionate about it.
Yes.
Talk about body preparation.
Yes, body prep. So oh gosh, where do I start? So here's one of the, I'm gonna like list out, I'm not gonna go into super great detail about these, we don't have a ton of time, but a few things that y'all need to think about if you have had a cesarean is, what are you doing now, whether you are pregnant or not? What are you doing now to make sure that your incision and scar is healed? Because that plays a huge role in giving birth, because there's so many things under these 7 layers, right, that we don't see, we don't feel necessarily, but it can actually impact labor in the long run. So we'll talk, we can dive in deep to like pelvic floor therapy, we can dive in deep to chiropractic care, but the first and foremost is, after you have a cesarean, once you kind of are cleared, we want to begin scar tissue mobilization. If you have not heard of scar tissue mobilization, it is basically taking where your incision or your scar on the outer layer, right? And you're basically going to be massaging and rubbing some of that scar tissue and clearing some of that buildup that happens once your incision scars over, which can kind of get in the way of baby. Trying to, which you don't really think about that. You're like, I'm good, I'm healthy, I did all this. But like you have a bunch of scar tissue blocking the pathway, right? So scar tissue mobilization, you can do that yourself at home. You can also go and have that done by different professionals. So that would be where I would start. And then you want to dive into some other providers, or just options to kind of help prepare bodies, and then we can kind of go back and forth.
Yeah, I think on that, you want to start as soon as you realize you need to start.
Yeah.
Just because if you go and you get pregnant again, the more you grow and you haven't done anything, sometimes that scar tissue, and it varies mom to mom. It really depends on how each body individually is going to scar, or not. Scar tissue is harder and it's rougher. And when baby develops and grows, baby can not want to go by where it's hard. And so they turn away, which can cause a malpositioned baby, or a baby that's not in a good position to have a baby, which means longer hours. So that's kind of the reason behind why it's very, very important. Pelvic floor specialists are great. I encourage that to anyone who's had a cesarean, anyone basically who's had a baby, because you just at least want to get checked out, make sure everything's okay. For previous pregnancy or pregnancies afterwards, or even later in our womanhood life. We want to make sure everything is going to function as long as we possibly can when we get older.
And it's
overall prevention. Chiropractic care is another great, I guess, birth team asset you can put on your list, just to make sure like everything is aligned and properly functioning, just overall wellness. Webster certified chiropractors is who I encourage for pregnancy and postpartum, just because they actually have a skill set to actually adjust and take care of a pregnant body with all the ligaments and the muscles and how the body adjusts to accommodate for baby. So that would definitely be something to look into. And if, let's just say you're not pregnant yet, but you're planning on having a VBAC, and you have some issues like your hip doesn't feel right, or maybe your pubic bone doesn't feel right still, that would be like some signs that you can go get checked out by the Webster certified chiropractor, or the pelvic floor specialist.
And the thing too is, like, for some of us, we may not have done any of this during your first pregnancy, and that's fine, right? Like, I didn't know the value and benefit of a chiropractor. I didn't even know what a pelvic floor therapist was when I was pregnant the first time around. But once you kind of learn this stuff, even if you're 36 weeks, even if you're 32 weeks, like, you can still go and get these things started right now, right? It's never too late to start any of those things. And it's not going to do anything but help you and benefit you, right? Because round ligament pain, back pain, like, it's common, but it's not normal, if that makes sense to y'all. Like, it's, a lot of us experience it, but it's because our body might be out of alignment, or we just need to get something shifted, or baby sitting in one position because they're more comfortable there because something else, like Krisha said, you could have scar tissue that's just, in the way and they don't want to be there. But that also, if your baby's not in the right position, that can impact labor. So no matter where you're at in your journey, going and starting that right away is going to benefit you. As far as the scar is concerned, there was a question about, like, how long do they stay red? Everybody's scar is different. So mine kind of like had like a keloid, just kind of like it's still like kind of puffy. And it's just, I mean, I didn't know anything about scar tissue mobilization either. So that could also have that's also probably a reason why mine looks the way that it does. So I wouldn't be worried. And I also still can't really feel a ton of things right around my scar. That is also very common. So I wouldn't necessarily worry too much about that. If that's your situation, it's not going to hurt you to have a VBAC. You just need to make sure that you had a low transverse incision on your uterus, not what you see on the outside. You have to make sure, you're going to have to go into your medical records, or at least have your medical records sent over to whoever your provider is, to make sure that you're eligible. That's truly the most important criteria for a VBAC. And then the only other thing that's really going to hinder you in a VBAC, or I guess what may make more providers kind of like iffy about taking on a VBAC client, is if you've had like a previous uterine rupture, or if you have that classical incision, which is vertical. So those are the two main things. If there's ever been like a surgery outside of a cesarean on your uterus that would make a uterine rupture, I guess, more of a possibility. But those things you just got to work with your provider on to see like if you've been cleared and all of those kinds of things. So
it's also how your incision was stitched.
Yeah.
On the first part.
Yeah.
That'll be in your medical records.
Yeah. So the I'm just reading this comment. It says uterus wasn't moving. And that so what I would say, like, if you have not seen a pelvic floor specialist, like your midwife or your OB, that's probably not their area of expertise, is to like work through scar tissue or anything like that. So I would still go check with a pelvic floor specialist in your area just to get another, just another support person, another resource to be able to maybe help you with some of that stuff and see if that makes a difference. So what about like exercise or, like nutrition or things that, movement and all that kind of stuff? Let's talk through, like, does that look different for VBACs versus just a first-time mom or anything like that? Although we are considered first-time moms again. So even though we've had babies before, this is our first vaginal birth. So keep that in mind. Like, we want to treat our bodies like this is the first birth that we've had, because we're going to have to unlearn some things. We're going to have to change our mindset about some things. So let's talk about that when it comes to like VBAC prepping your body.
So I can tell you, based on my experience with my VBACs, I prep them and train them just how I would someone who has not, like a first-time mom. I put them through the same exercise program. I encourage them to eat healthy and nutritious for their themselves and their baby. I encourage chiropractic care, pelvic floor specialists if they need it, the scar tissue massage. But I think more than, like, I think physically they're very capable if they want to be.
Yeah.
I think it's more a mental aspect as far as what we've heard from others. Don't do this, don't do that. Oh, wait a minute, what do you think? I'm not too sure, because you've had this cut in your body across those 7 layers. Some of us, it's traumatic. Some of us, it may have not been. But I think as far as a mental block, I think sometimes it could be, well, I don't want to do that because it might hurt, or I don't want to do that because, and bring it back to what happened. Yeah. So I think that is more, me personally, I think that is more encouraging and helping the VBAC mom find the confidence and basically reestablishing and trusting her body that, yes, she can birth a baby vaginally.
I agree. I think the biggest thing, because, if you work with Chris or I, you'll know, or if you have followed us for any amount of time, you know that being active and moving around is very important to us. And so we've seen it work well in my birth, the births that we've supported, for a lot of the other mamas who have taken our classes. Like, the movement aspect of birth is beneficial. So if you are a VBAC mama, like, regardless of what your first birth story looked like, you need to start practicing moving around, period, and being active, period. Like, whatever that looks like for you. It doesn't have to be you running. It doesn't have to be you doing HIIT workouts every day. It could be you doing yoga every day. It could be you briskly walking some days and then doing something else on the other days. But your body has to build up endurance, right? And more mental and physical endurance you have, the better labor you're going to experience. And I think overall, like, the two things that have to be true, in my opinion, is that you have a birth team, and that birth team includes a doula, because I have found for myself, right, even though I was so confident, right? Even though I saw it in my mind. I pictured it. I was like, I'm going to have a VBAC. This is what's going to look like. I'm going to be so just elated at the end. And that's what happened. But I know, no matter how confident and prepared I was, because I felt very, very prepared for this. Like, you trained me well. Like, my body was prepared for this. I still don't know if it would have looked the same. Not saying it wouldn't have happened. It just might not have looked the same had I not had a doula. Like, that's it. Because we all know, if we're going for VBACs, you know where your mind goes in labor. Like, you know what happens. Like, your mind can go all these different places. You can get defeated, all these things, right? So the first thing that has to be true is you have to have a support person, somebody who's going to coach you and guide you and help keep you in the zone. Even though COVID is still causing limitations for us in birthing places, like, I'm a virtual doula. There are virtual doulas out there. That does not mean that you cannot have that support person there, even if they're not there in person. But then too, like I was saying, you have to move your body, y'all, because if you do not move your body, when you go into labor, if you have not worked through your mental baggage and healing from your previous birth, if it caused trauma for you, which is what I had to do, it will show up in labor. And what's going to happen is your brain is going to close down and your body's going to close down. And then you're just going to be like a little turtle, and you're not going to want to move. And you're going to be, like, you're going to go through this whole thing, which is going to actually be counterproductive to where you're trying to go.
Open up.
Yeah, like you're closing.
You have to open up and expand to have a baby.
Yeah. Yes, exactly. Like,
and
your jaw, everything has to be open if you're going to be open there. Like, period. So if you have not practiced that, it's going to be really hard for you to just like pull these tricks out of thin air, because we talked about them on this live when you go into labor. Like, practice. So
yes, train for birth. That's what you need to do. Train for birth.
Yeah, exactly. So there's so many different resources out there, and I will get off my soapbox now, but I'm very passionate about this, if you haven't noticed by now, because it's possible. And especially, like, if you're a Black mama on here, and I just want to be like very clear about that, you have to do this even more. Like, your training and preparation, and I don't want to be like, just that person, but I'm just going to be very honest with y'all. Like, your training has to be much more intense and intentional, because there's this thing called a Vbac calculator. And if you have not heard of it before, some providers, they're not going to tell you, using this Vbac calculator, but there's a thing called the Vbac calculator. And what it does is it takes all of these different things into account into this calculation that basically spits out how successful or how likely you are to have a VBAC, like a successful VBAC. And race has been shown to play a factor in how those calculations are coming out, which means that if you are a Black mama, sometimes, depending on your provider, right? This is not everybody, but for some who have providers who use this calculator as a determining factor of how successful this VBAC is going to be, that calculator can put us at a disadvantage on the scale of having a VBAC. And what you don't want to happen is you do your prep, all these things, but you just kind of like did the bare minimum, and now we kind of fall back into like the hands of somebody who kind of is looking at us on this scale versus like us as a person. So that's why when we talk about healthcare providers, it's really important that you trust that person. If they believe in you, they believe in your birth plan, they're going to support you in whatever your wishes are. Because if you look at the research there, you will see that VBACs for mamas of color, the outcome looks different by the numbers. And a huge reason that is not because we're not capable. It's not because we didn't do the right thing. It's because of, just how we're viewed from this very biased calculator that exists, unfortunately. So it's important that you prepare yourself. It's important that you take classes. It's important that you have a support team, not just a good healthcare provider, but a good doula and a good chiropractor and a good all of those things. And that your partner is also prepared, because your partner has a huge role in this too. So make sure, if nothing else, that you take both of our classes, because you will be prepared. And I also have a VBAC course that is very specific and going through a lot of these things. It is going to be released April 18th. For those of y'all who want to go through this, it is, again, very Vbac specific. And then obviously still make sure that you take a full childbirth education class and that you take Train for Birth, because there's so many, we cover birth from so many different aspects, right? And so having all that knowledge and being educated on all fronts is going to be the best thing that you can do for yourself in that situation.
Yeah.
So
yeah,
that's my soapbox. Thanks for coming to my TED.
You can do it. That's all I gotta say. You're so able.
Yeah, you are. Any other thoughts, things that we left out really quickly? I know we kind of went long, but
the only thing I can think of is on April 30th, the Vbac Summit is going to be coming on, and that's Natriel Vbac. I'm actually a presenter in one of the 15 global speakers that I will be on that presentation, which is virtually on April 30th. So that's something to check out as well.
Is it in your bio for people to
tag them in the comments for this? So
okay.
As well. But yeah, they're an amazing Vbac support group as well. They are on Instagram. Yeah, I would encourage you to follow them too. They have some great content they post as well.
Good. Okay, y'all. So
surround yourself. Surround Vbac stuff, and it'll come up here and you'll get your blinders on, and you're going to go for it, because you're going to realize that, yes, I can do this. I'm totally capable.
Yes, absolutely.
No doubt.
Thank you, guys. Thank you, Krisha, for joining me for this two-part series. Y'all, this will be saved, so make sure that you watch this, you share it, you watch it again multiple times to keep yourself confident and make sure that you are on the right track. I will make sure to put all the information for all of our upcoming courses and things in the comments or in the caption. And I hope you'll have a good night.
Yes.
Have a
good night.
Bye.